Good afternoon, everyone. Thank you for being here. My name is Sundar Balasubramanian. There'll be a quiz after this. Right. I'm working at the Department of Radiation Medicine at the Medical University of South Carolina in Charleston. I've been working in the scleroderma area since 2015. So my main goal is to improve patient quality of life through breathing exercises and gentle yoga. So the way I started this was that one of my colleagues, Dr. Fegali Bostwick, and Dr. Silver, very big role. A little later, Carol Fegali Bostwick, she introduced me to the group in Amy Parish Patient Education Day in Charleston. So that's when I started working with the community, and I really loved it. And then ever since I've been following almost every year I'm in these meetings. Why am I so interested in those breathing exercises? I will make the story short. When we change the way that we breathe, right? We breathe somehow or with some difficulties, we breathe. The important thing about the exercises that we are talking about is that regulated breathing or mindful breathing, when we pay attention to the way that we breathe, when we change the way that we breathe, either by breath hold in or out to the level that's possible, not to the level that is going to be super stressful for us. When we do these exercises, what happens is that we stimulate the rest and digest or rest and healing responses within our body. We have the stress system, we have the other healing system, right? Relaxation system. So the relaxation system is kind of stimulating salivation. So more moisture in the mouth, more moisture in the eyes, and other internal moisture too. So what we learned from our studies, first set of studies, is that when we do the breathing exercises, we stimulate salivation. And the salivation is not just the digestive fluid. It has many different proteins, protein molecules that are important for several functions in the body. So I'm from the tradition, yoga tradition. I learned yoga from my family members, and that's when I was, by the year 2013, I wanted to bring my science. I'm a biochemist. I want to bring the science of whatever I learned in the lab with the ancient tradition. What happens when we do the breathing exercises in the saliva? What changes occur in the body? So some of you might have, I saw you guys in the poster downstairs. Or in the same level. So that poster is about what chemicals do we see in scleroderma patients, specifically when we do the breathing exercises, right? The first set of studies that we did was in non-scleroderma population, where we showed that there is an induction of molecules like nerve growth factor, proteins that are needed for the growth of neurons, the healthy neurons, how to make them survive for a long time. Those molecules are stimulated in our body. We also showed that there is an induction of proteins responsible for our immune function in the oral, nasal, the ocular, so those mucosal surfaces. And there are proteins needed for the tumor suppression. We produce, because of the insults on a daily basis, we produce a lot of potentially tumor cells in our body. Those cells can be discovered by our own system. We have a system called the tumor suppression, or proteins called tumor suppressor proteins. They will discover those type of cells and get rid of them on time. If we don't do that, it will grow more. So what we showed was that there is more tumor suppressor molecules produced in our body. So it's not a magic, or it is not something that you can do only after 12 years of meditation in the Himalayas. No. Even if you learn it in 2 minutes and start doing the breathing exercises, as early as in 5 minutes, you will be able to see those changes in your body, as we saw in the saliva. And after that, we also showed that there are proteins that are kind of functioning like inflammatory molecules. They go down. So you essentially reduce the potentially inflammatory molecules in your body, creating a less space for inflammatory damage in the system. So these are the first set of evidence. And then we started working with other areas like cancer, aging, employee wellness, and dementia, and then, of course, scleroderma. So the scleroderma trial, the poster, this talks about 30 patients from South Carolina area, both non-Hispanic whites and African American patients, and all women. We showed that in this exercise, it's a 12-week program. We asked a little too much from the participants. We asked them to do 2 times 1 hour every day, just like 2 hours. It's not right. We thought, when I was thinking that they're all in a yoga camp. So that's not really. That's how we used to do, like 4 hours of meditation. That's normal. But it was my, something wrong on my side. Then we learned that people were not able to adhere to that. And what we learned was that they are able to do that for 15 or 30 minutes every day. That's kind of the ballpark that they were talking about. We'll be able to do that for 15 or 30 minutes. But what that study showed me was that, number one, there are no adverse events. People always talk about adverse events in breathing, in scleroderma. They say, like, oh, they cannot hold the breath. They cannot do the breathing exercises. But none of that things we come across. There was no adverse events because all the exercises can be done in a way that you are able to do. You don't have to do in the same way like a yogi person would do, right? So you can change if I say, hold it for 5 counts, you say, I can hold it for 2 counts. You said, okay, yes. That's how it works. You tailor the exercise for you. You know you better. And what we also know is that the satisfaction about the exercises were really high. And also we know that there are many different molecules that are related to fibrosis, molecules that are related to immune function. These are altered in a big manner, significant way. Those are some of the key findings from that recent clinical trial in scleroderma. We are now moving forward with PICORI, like Patient-Centered Outcomes Research Institute grant funding on rare diseases. So we are combining a group of diseases, including scleroderma, where breathing or dyspnea is a common problem with fatigue and pain. So we are collectively putting together many different clinical conditions and are going to reduce the time that we require them to do the exercise, maybe 15 minutes to 30 minutes, and then do the whole session or whole trial is going to be virtual. There is no in-person trial. Everyone is going to be all over the United States. We'll be contacting everyone, your chapters and everyone as much as we can, and then we love you to participate in those research, right? As when we get funded. That's a big thing, getting funded, right? Okay, so I will stop here and we'll jump into exercise or calm down into exercise. Any questions so far? Anything? Yes?
I can hold it if you'd rather, but you mentioned molecular changes. How do you measure?
Yes, we collect saliva before and after exercise. So saliva is one of the notorious, very convenient, not very convenient. It is okay. It's better than taking blood samples, right? For some people, it takes little, like if not 2 minutes, it may take 5 minutes to collect that saliva. The saliva that we collect before is much, much different from the one that we collect afterwards. That's why we compare internal comparison within the person on the same day, before and after. The only thing that is different is the breathing exercise. That's why we are able to kind of put the baseline as the standard, and then and we are able to control for that.
So is the patient or the individual taking their own samples?
No, we will collect it. Yeah, we have a technician who would just hand the test tube to the person, and they will just drool into the tube and then put it on the ice. That's it.
And you mentioned wanting to recruit a lot of people for the next phase. Is this one of the few studies where you don't have to be newly diagnosed?
Yeah, it can be. It can be anyone. Yes. Yeah. Right. Yeah, I know that this can be, the only thing would be that if you are already practicing maybe more than 1 hour per day, that may be something that ineligible thing. But other than that, everyone is good to go. Yeah. Thank you for the question. Yeah. Any other questions? Please feel free to ask the questions. Let's go ahead and start the practice. Can everyone see me? Okay. I'm not super tall, but it's okay. So, all right. For all these exercises, the only important thing is that if you're not comfortable, stop the exercise and continue with normal breathing. And you can change, if I say any counts, you can change the counts. It can go slow, medium, fast, however you like, right? So let's, if you're comfortable, close your eyes. Sit comfortably and gently bring your awareness to the tip of your nostrils. Unless specified, all the breathing is going to go through the nose. This is our normal breathing. It may be shallow. We are not paying any attention to it, or at least we were not paying attention to it. Maybe we can watch the temperature of the air that goes out, a little bit warmer than the one that goes in. And following the path from the tip of the nose to maybe the forehead or top of the head, or it may be the chest and the abdomen, whatever is moving in response to the breathing. We watch the minute sensations around the movement of the breath. At the end of exhalation, just before you breathe in, watch that intersection. What happens? How do we start the inhalation? It may be happening on its own, but we can take a pause and watch it. Assess what's going on. How do we breathe in? What are the places that work together to begin that inhalation? Is that starting from the ears, or from the eyes, or deep down? We are not changing the breathing, we just watch. Now slowly breathe out, again through the nose, relaxing the upper chest, the lower ribs, and then the tummy. Breathe out, tuck the tummy in, and slowly relax, allowing the air to go back in. The tummy expands, then the lower ribs and upper chest. Breathe in as much as you can, comfortably, and then slowly breathe out, relaxing the upper chest, lower ribs, and the tummy. Very slow breathing in from bottom to top, and slow exhalation from top to bottom. Allow the mind to follow those movements. Watch the breathing is moving very slowly and deeply. The key thing is, how do we exhale? We tuck the tummy in and exhale a bit more. The mind is watching all the movements from bottom to top, top to bottom. It is the interoception, awareness of bodily movement. It helps the mind to be within ourselves. It stops the mind amplifying things in the past or future. It helps you to be here and now. This is called deep breathing, simple. The breathing rate normally runs between 12 and 18 times per minute. But when we do this mindfully, when we intentionally slow it down, we breathe only maybe 5 times, 10 times, or even less than that. This is a good signal from the diaphragm to the brain that we are relaxed. We are not stressed. The same slow exhalation can be substituted by singing or chanting or simple humming. So let's try the humming. Inhale, the same slow fashion, and exhale as a humming at your own pace. You exhale and then inhale, exhale. Every time you exhale, exhale as a humming. Slowly come back to normal breathing. Watch the breathing. When we watch the breathing, we kind of bring our awareness to the points where or wherever we are able to experience the movement of the breath. It may be the forehead, top of the head, or throat, chest, wherever it may be. Just follow how the breathing is moving there. Good. You can open your eyes. This is a combination of a couple of different exercises that we did. We did watching the breathing, right? So how to bring our awareness to breathing and understand how we breathe normally without changing anything. This is my normal breathing. It may be shallow, it may be very fast. When we pay attention to that process and then intentionally deepen the breathing, slowing it down, especially engaging the tummy. When we engage the tummy, we nicely engage the diaphragm. So the diaphragm is attached to that relaxation response. It's very important, right? Any question? And when we do the humming is also a good way to release nitric oxide-like molecules from the sinuses, goes out, so you'll be able to breathe better, circulation gets better too. So there is a very good signal between respiration and our circulation. So when we are able to breathe better, we will be able to circulate our blood much, much better. So it's a key signal to the circulation. Okay, always think about better breathing is better circulation of not just the air, but also the blood. Okay, so now let's go to the next exercise. Here we are going to use the same breathing pattern, but we will be breathing in through one nostril, and then out through the other nostril, and then breathe in here, breathe out of the other. It goes up, down, right? Very slow and steady. The most important thing in this exercise is that we pay attention to the awareness, like focus on how do we feel the movement of the breath just in the head area. So sometimes in the middle of the head, middle of the forehead, or deep inside of our head too, you'll be able to feel the movement. So the interesting thing here, it's the olfactory bulb. Those nerves are connections there. So these olfactory bulbs are important in taking the information from our breathing and connecting it to the brain. So this information is very key. How we feel, please come. How we breathe and how that information is kind of sent to the brain for changing the way that our brain is, influencing the bodily functions, right? Either it is producing the neurohormones or producing the less amount of stress hormones, things like that. Okay, so let's try that. If you have any question, please feel free to stop me. There is a switch between left and right nostrils, which is called the nasal cycle. This nasal cycle is important for maintaining a proper brain function or hemispheric functions. Sometimes we get stuck on one side of the nostril or the other. So this exercise will help us to reset that nasal cycle. Studies show that it can improve attention, hand-head coordination. And also, one study shows that it can improve the grip strength, hand grip strength. It's all happened probably through the awareness and also through the maybe the factors that we think it produces. Remember to breathe out better by engaging the abdomen. Watch which nostril is more open right now. It may be left for someone, maybe right, or it could be equal. The left is associated with cooling sensation. The right, on the other hand, is about warming. One is the moon, the other one is the sun. By engaging both of them, we are bringing the balance between the cool and warm breaths. This nasal cycle is a very hard area in neuroscience. They try to understand how this happens, why this happens, and how this is related to the functions of the hemispheres, especially the opposite one. The right nostril is connected to the left hemisphere, and vice versa. This is one key exercise that you engage the two olfactory bulb neurons separately. When you breathe in through the left nostril, you just engage the left olfactory bulb. There are certain actions that are connected to the left brain, and there are certain actions connected to the right brain. It's very interesting. Nobody is like a left brain person or right brain person, like in those old belief. Both hemispheres interact, collaborate. Two more rounds. At the end of exhalation, come to normal breathing and watch the breathing. Especially watch where you can sense the movement of the breath. And you can open your eyes. Is that any questions with this one? Was it okay? Sometimes we feel that it's more open on the right side, sometimes it's on the left side, but we keenly watch, it'll be switching every maybe an hour, or sometimes it has a longer stretch on right, longer stretch on left. So what you'll feel is that sometimes when the right nostril is kind of always on, you feel a little bit warmer, more able to do some physically challenging activities. When the left is more dominant, you'll be able to do some focused work, like reading, writing. Those stuff will be much easier to do. So that's how these two systems are helping us to determine how we can improve our performance. What would be the best activity to do at that point? So if I'm sitting down to read, if I'm not able to focus, this is what I test. So this probably is not the problem of me, it is the problem of my nose, right? So and so I probably either change the nostrils or just change the activity. So I'll be more productive, right? And let's move on to the next exercise. This is the breath hold practice. Caution. So if you are able to hold the breath even as little as possible, that's good. So why do we do the breath hold? It's easy to understand that when we hold the breath, we raise the level of carbon dioxide to a safer level. It's not too much, too bad. So this little few millimeter mercury of carbon dioxide raise would help us to improve our blood vessels, to open up a little bit more. So the blood flow gets better. So when the blood flow is better, you have more immune cells to go into the deeper tissues, clean it up, has more oxygen to be delivered, more carbon dioxide and the other debris to be removed from those deeper areas. So it's a very easy mechanism that the body uses, measuring or sensing the carbon dioxide. So we exactly use the same mechanism to improve that, right? So in this one, we inhale through the left nostril for a count of maybe 2. The 2 counts maybe I am powerful, I'm beautiful, I'm peaceful, anything you want to say to yourself for twice, right? You say that twice in your head, and then that's a time length for inhalation. Say if I'm saying something inside, it will be like, so 2 counts, that's a complete inhalation. It's a swift inhalation, a little bit fast, but again, to your comfort level. And then I hold the breath for 8 counts of the same thing. If not 8 counts, 4, 5, whatever is comfortable for you. Hold it and then breathe out for 4 counts. So 2, 8, and 4. If you're not able to maintain that number, don't worry at all. You still will be able to practice. So the easiest way is to inhale fully, hold as long as you can, exhale completely, and then repeat the cycle. It goes in one way. So it always in through the left nostril, hold it, out through the right, and repeat, right? It's not going in the opposite as we did before. If you have any question, please feel free to let me know. Right? We'll try that. If you're not comfortable breathing in through the nostrils, you can do the same exercise by inhaling for the same duration with both nostrils open without using the hands. Just complete inhalation for the same duration, holding it and then exhaling it. The idea is to sustain this level of breathing for at least 5 minutes, but one can do all the way up to 24 minutes in a given sitting. This is the exercise that I followed for the clinical trials with the salivary proteins. And this was derived from one of the ancient yoga texts that measured or that indicates the measures of inhalation, holding, and exhalation. At the end of exhalation, come to normal breathing and watch the breathing. And again, look for any change in awareness with the breath, the place where it is experienced, the quality of the inhalation and exhalation from and to into that space. And you can open your eyes. So with every exercise, you probably noticed me that saying to watch the breathing, right? Because every exercise would change the way that we perceive breath. That is a good opportunity for the mind to be within ourselves. The mind will watch us. It's based on the place where the breathing is experienced. So it's a very good way to lock the mind or cultivate the mind. It is the source. It's a very important tool for us to gain information about so many things that we learn. But it is also the source of our fear and anxiety, everything that it could bring in potentially. So by bringing the mind to a bodily sensation, we cut those kind of unwanted signals from the mind. So that's why the mindfulness is very, very interesting and useful in this case, right? It's been studied in many different conditions, especially in the cancer area that we have seen that this exercise specifically reduces anxiety and depression in breast cancer patients that had radiation therapy and for the practice of 12 weeks. Okay? And we can do another exercise. This is something that my favorite one before going to bed. Right? Somebody talked about sleep, right? So the sound is that basically the ocean sound breathing, right? You create the sound. Just constricting the back of the throat, and we create the sound of the ocean. Right? We just hear the same sound. It's a good feedback to the brain about how we breathe. And also it's kind of the restrictive breathing. It also improves our breathing. And what you'll see is that initially you will be extending the breathing, right? Nice and deep. But slowly you will be moving into a state of meditation. Like you'll be relaxing, your breathing may be shortened further and further, indicating that you're going into the meditative state. It's a very good exercise before trying to go to bed, right? If you're not able to make that sound, it's just basically a sighing sound, but something like but with a closed mouth. Sometimes it may sound like snoring. Yeah, so it is basically, you will be able to produce a sound back and forth, both inhalation and exhalation. So try that. At the end of exhalation, come to normal breathing. Again, watch the breathing. And you can open your eyes. One more exercise is that the smiling breath. It's very easy. And what we do in this one is that we smile, right? And then breathe in through the mouth and out through the nose. So there are so many minor salivary glands all over the oral cavity, not just the major ones, the 300 to 600 minor ones all over the cheek, inside of the cheek, the soft palate and area, and then on the tongue too. So they produce several neurohormones with the immune function and other functions too. So the cool air can stimulate those glands too. So it's just a then out through the nose. It's a fun little trick also to the brain. The brain thinks that we are smiling. During the inhalation, feel that cooling sensation in the gums or cheeks. And the exhalation goes with warmer air through the nose. The process of breathing, interestingly, connects or targets the same areas that are stimulating our motivation, our creativity, our instinct to be surviving. Everything is pointing to similar areas in our brain. So anything that helps you to stimulate dopamine, for example, can be stimulated with our breathing too. So it is the first step. We think that breathing is a gateway through which we'll get initial motivation to improve our activity, physical activity, or anything that follows. It's a very important area. How we can use breathing to improve our motivation, and how we will be able to be feeling the sense of joy. And slowly come back to normal breathing and watch the breathing. Watch the overall sensation about breathing. Maybe you can imagine that the exhalation is slowly kind of diffusing through the top of the head. We breathe in and out through the nose, but the exhalation is escaping very slowly through the top of the head. And take a deep breath. Thank you. Thank you all for your attention. Yeah, you're welcome. Thank you. Claps to you. And I'll be happy to take any questions if you have.
I'm curious about the taking breath in to holding 8.
Yeah.
Exhale 4.
Yeah. Mm-hmm.
What is that doing?
Yeah, so the breath hold, the question is about 2-8-4 breathing. What does it do? So the main thing it does is that it increases the time that you're holding the breath. So the breath hold is the longest duration. So that's where we accumulate carbon dioxide. That is the time that it helps us to improve the circulation. Yeah, and there's also the same exercise that increases salivation too. So increased salivation, increased tears, so it will be helping the dry mouth as well. Yeah, this is where we see the salivary secretion and then measure the proteins. Yeah. Okay. Any other questions, thoughts? Yes.
And I've had this happen for a long time, but I'm able to take in a lot. I'm not as able to let out for as long. Part of it, maybe I'm going too quickly, but also I just don't feel like I really have it to release.
Yeah. So one of the things that we don't pay much attention is how we engage our abdomen. So the abdominal breathing or exhalation by tucking the tummy in voluntarily or intentionally, that will help us to exhale for a little longer. The other thing is like in the initial stages of our inhalation or exhalation, we try to do a lot more. Right? In the inhalation, you try to inhale a lot, more than 50-60%, and then the rest is quickly filled. So we mindfully control that. So we can train our system to slow down on the exhalation, make it even from the beginning to end, and then engage the abdomen. So we are saying in Tamil, when you go to the doctor, I cannot breathe. They don't say I cannot breathe. They say I cannot exhale. So the exhalation, especially the end of exhalation, it can be more active. That's where the diaphragm is nicely exercised.
And I think I'm better at it when I'm lying down, actually, maybe because I've practiced it more, but while I'm engaging the abdomen, am I kind of pushing my back to the back of the chair?
Yes. Yeah. Yeah. Yes.
What did you say was happening when we hum? Is that?
Yeah. So there are like the sinuses in our system. They produce things like neurotransmitters like nitric oxide. So they get released into the system, the airway, and it helps us to improve our breathing. This is something that is known during the COVID time also. So how people are able to use that nitric oxide, or even the hypercapnia, like how carbon dioxide can be useful in treating some of the exacerbations. So this is basically, we are using the same system, but more naturally, right? Yeah, during COVID, we had some classes that were completely virtual, only the breathing, we did breathing exercises and mild chair yoga too. So people were saying that it's more comfortable for them to do, whether rural, urban, easy to handle the virtual classes. It's all like, it was very easy for them to do that, participate. So that's why we are moving into virtual, complete virtual in our next trials. But these are great information. There's a lot more research has to be done with all these exercises and the way that it works and what are the different types of markers that we can measure in the saliva or elsewhere. Yeah. Very good. Thank you. Breathe well and enjoy the rest of your conference. Bye. See you all. You're welcome. Yes. Yeah.